Thanks everyone for the chance to share this chapter. It's been a combined effort of a number of contributions, and what we try and do is to give you a sense or a flavor of the vulnerabilities that many have been exposed to during this time. The chapter was made up of a number of different contributions, particularly those who draw on various, if you like, sections of vulnerability. So there was work from Scott Drimmie on food. Tim will be sharing just now a lot on the social protection. We had Gillian Marie, who's been doing a lot of work on trying to capture the data around the COVID pandemic, in particular for the Gauteng area. And then we had others working on gender, etc. But I do want to stress that this chapter highlights some of the key vulnerabilities and then is rooted into other chapters. So in 20 minutes, one cannot go into all the details of the drivers of vulnerability, but hopefully we'll be able to do a good job. And you can find a lot more detail in the actual chapter, but we welcome any comments and areas for improvement. So the chapter outline will start first of all by giving you some of a background around the characteristics of social protection, in particular the legal and regulatory environment of social protection and how that progressed during the various lockdown phases. We'll then try and give you a sense of a feeling as well as some of the issues, the drivers of some of the basic services issues, human settlements, basic services, water and sanitation, food and primary health care. As I indicated earlier, not all of these will be dealt with in today's presentation, but the details are evident in the actual chapter. We'll then turn attention to children and adolescents, refugees, asylum seekers and migrants before concluding. But before we actually enter into the meat of the chapter, I wanted to just give you some sense of the framing that we chose. As was indicated, I was part of the Disaster Management Act crafting, and we were very clear in that act, and it still is a tenet of the act, that we need to understand vulnerability. And understanding vulnerability is not just looking at the exposure to the threat, for example, what the pandemic suddenly brings with it, but rather to also understand the reduced capacity to cope and recover. And what you see there is how this is linked to the lack of access to resources, in particular health services, credit information, which have already been raised in the education chapter, and then the lack of resources, income, assets, social support, etc. So the framing of vulnerability is quite large, but to get at the drivers of vulnerability, it's all very well to have pretty maps, if you like, of spatial extent of vulnerability, but one really needs to get at the root causes of what is driving it, and that is what we try and do in this chapter. I need to acknowledge that there are various other approaches to vulnerability, but as indicated, we've used the disaster management framing in the main because the Act and the departments and the efforts have been framed under the disaster management process for the country. But one can obviously find other processes and ways of doing things from other sources. I now hand over to Tim. Thank you.
Cool. Thank you very much, Coleen, and good morning, colleagues. Thanks very much for having me. So in this section of the chapter, we focused largely on South Africa's relatively comprehensive existing system prior to the pandemic of social protection. And that consists of both social assistance, which is largely tax finance unconditional cash transfers or social grants, as well as social insurance, such as the UIF and compensation fund. So first and foremost, it should be noted that from the beginning of the pandemic, we observed across the world a huge, substantial increase in the number of social protection measures related to the pandemic put in place by governments across the world. Specifically, in around about the beginning of the pandemic in March 2020, we saw about just over 45 countries implementing about 105 social protection measures in response to the pandemic. By around about the end of September, beginning of October 2020, just a few months later, the number of measures increased by more than eightfold to nearly 1,500 measures in over 200 countries. The work done here by Gentilini et al. At the World Bank has since been updated, and we will use that in following editions of the chapter. But in short, more than 3,000 social protection measures have been put in place in response to that pandemic in over 200 countries. about 2/3 of these measures are in the form of cash transfers or social grants, and about half of these cash transfers are new measures. In a similar light, the South African government, a core policy response of the government was an expansion of social protection to provide income relief primarily to low-income individuals and households, as well as firstly individuals working in the formal sector, but later on all eligible individuals regardless of sector. So the basic structure of South Africa's social protection system can be provided in this figure here, where on the one side we have social assistance, mainly consisting of social grants, as well as the expanded public works programs. And then on the other side, we have social insurance, which can be disaggregated into the statutory component and the voluntary component, which is regulated by government. In this chapter, we largely focus on the amendments to the system, namely the top-ups to all pre-existing grants. That is, every single existing social grant was topped up by about 250 Rand per grant from May to October. The exception is, of course, the child support grant, which was topped up per grant in May, and then per caregiver, per grant, 300 Rand in May, and then by 500 Rand per caregiver from June onwards to October. The top-ups to these grants ceased from October 2020, whereas on the extensive margin, we also saw the addition of a new grant to the system, the Special COVID-19 Social Relief of Distress grant, which was targeted to individuals who were unemployed and weren't receiving any other form of government assistance, which includes social grants as well as UIF, for instance. And I'll touch on that grant in more detail later, but it's important to note that this grant is distinct in the system, largely because it is the first grant in at least post-apartheid South Africa to target a group of individuals who were previously unreached. That is the working-aged unemployed. Of course, as is widely documented, the social grant system is relatively well targeted to the poor, mostly because almost all grants are means tested. And the Social Relief of Distress grant, the COVID grant, was notable in that it brought in just about 6 million unique individuals by the end of 2020. Who were largely previously unreached by the system. So just a brief mention of the grant top-ups again. Every single grant was topped up by about 250 Rand, and we document that briefly in this table. Of course, with respect to the grant amounts prior to the pandemic, the increase in the grant amounts in relative terms, of course, varied. For instance, most grants increased by about 13.4%, but the child support grant, owing to the low amounts of the grant, 440 Rand per grant per month, increased by nearly 70%, at least in May. As previously mentioned, the grant system was relatively comprehensive prior to the pandemic. We know that by the end of the 2019-2020 financial year, about 18 million individuals were directly benefiting from the grant system, which constitutes just under a third of the South African population. And of course, this estimate grows to over 50% if one considers individuals who benefit from grant income who live in the same household as grant recipients, but don't necessarily directly receive social grants themselves. Owing to the introduction of the special COVID grant in the pandemic, the grant system grew substantially by about nearly 10 percentage points. In other words, the COVID grant brought in just about, depending on your specific estimate or period of interest, just about 6 million unique individuals into the system. To put that into some context, that exceeds the growth of the entire grant system in the last decade in terms of the number of recipients. In the chapter, we include some detailed analysis, largely from our studies using the NIDS-CRAM data on social grant receipt during the pandemic across different groups of individuals and workers, with a focus on vulnerable workers who we define by using specific demographic and labor market characteristics. I won't go into detail here, given our time limit, but there's, of course, a lot more detail in the chapter. First and foremost, the introduction of the COVID grant, we see that both application for and receipt of the grant has been largely pro-poor. And of course, what I mean by that is that the majority of recipients are based in low-income households. For instance, we can see in the graph on the left that about 90% of individuals who live in the richest 10% of households as of in the middle of the year last year, never even applied for the grant. When we use fiscal incidence analysis to consider how the COVID grant affected poverty, of course, this method that we use is limited just because of the data that is available to us. But if we simply compare per capita household incomes, including and excluding the income from the COVID grant, we do observe a poverty reduction of about 5% or 2 percentage points. And we observe higher rates of poverty reduction amongst the poorest households. For instance, when we use the food poverty line of 585 Rand per month. Recipients of the COVID grant were mostly unemployed. Those who were employed in the informal sector. They were youth, male, and self-reported African or Black. Of course, one critique of the COVID grant was relates to its arguably unfair discrimination for the caregivers who receive child support grants on behalf of children, which I'll speak about a little bit later. Looking at the other side of the social protection system, one of the most notable expansions was on the extensive margin, which included the introduction of the TERS, the Temporary Employee Relief Scheme. Although financed from the UIF, the TERS is essentially a wage subsidy policy, which is a popular policy used throughout the world in economic crises to aid labor market recovery, especially when quick rehiring is prohibited. So the TERS is essentially it provides wage support to firms who had to either completely or partially close their premises in response to the pandemic. And in simple terms, it pays a proportion of the wage bill. Benefits range from 3,500 Rand to just under 7,000 Rand. So they're much larger than the grant top-ups, and benefits are relatively progressive, given that lower wage workers are eligible for a higher proportion of their salaries covered. By the beginning of this year, nearly 60 billion Rand had been paid out to roughly 4.5 million unique workers. That's equivalent to a third of all formal sector employment. Most, using the NIDS-CRAM data, we can observe that most TERS payouts or TERS recipients only received a payout once. Of course, given the data limitations, we can't observe how many payments TERS recipients received. But when we look at receipt of TERS across different groups of workers, specifically the vulnerable, we do observe that for the majority of workers, it's largely in line with their employment shares. For instance, if the youth represent about 40% of the employed in a given month, we largely see that 40% of TERS recipients are the youth. However, we do observe in the report some under-receipt with respect to workers in the informal sector, as well as those in poorest households. In conclusion, just briefly, we go into more detail in the chapter with respect to social protection, especially receipt amongst different vulnerable groups. And we conclude with some particular policy considerations with respect to either extending or amending the eligibility criteria of the COVID grant. Of course, in future editions, we can include further work being done on the labour market and economy-wide effects of the COVID-19 grant and TERS receipt, as well as incorporate new data from the NIDS-CRAM, specifically the last two waves, which are being used for now. Thank you.
Thank you very much, Tim. So I will continue now, focusing in particular on the way, if you like, the faces of the vulnerable. What Tim has provided you with is an overview of how we responded to actually assisting the vulnerable, but who are the vulnerable and where are they located and what is actually driving their vulnerability. And the point that we make in the chapter repeatedly is that vulnerability is insidious. It's located in the system already structurally for a number of reasons, both the legacies of apartheid, but also from a number of issues that have arisen now in our country, which I won't go into more detail, but around governance, even the, if you like, lack of application of the Disaster Management Act, which I think is coming through in some of the legislation chapters, which have been dealt with in this COVID report. So what we're going to try and do now is give you a face of that vulnerability. What does it look like? And we've been very fortunate to be working with the GCRO. We have a section in the actual chapter as an appendix showing a syndemics approach, which is a co-occurrence, if you like, of different diseases which can rear their heads and make themselves visible in terms of vulnerabilities. But here we just give you a flavor of what the mapping and where the vulnerable might have been located and are perhaps being located at the moment. Again, you'll see that it's not really rocket science in the sense that it's actually showing us what we actually know already, but what we need to get a handle on is how the vulnerabilities have either been heightened or dampened by COVID. So the poor communities are likely to bear the brunt of the dire health and socioeconomic consequences. And in addition, the various shutdown measures already in place will already start exacerbating and nudging people into, if you like, more vulnerability going forward. The areas of the vulnerability map quite well onto existing vulnerability maps that we already have, in particular to other stresses, for example, for climate risks, drought, floods, etc. So these kinds of maps are very interesting, but you need to try and get behind what is driving that vulnerability. So this is where we then drew on the expertise of different people. Here we drew on the Water Research Commission and the work that they've been doing to try and get an understanding of the different types of faces of vulnerability. Here we looked at water and sanitation. I draw your attention to the map at the bottom, which makes the point again that the vulnerability is already inherent in the system. You'll see along the eastern coast, I'm not sure if it's very clear for you, but the community, the numbers of needs, percentage of households, in particular along the eastern parts of the country. We know about the droughts already occurring in the Eastern Cape. So we should have been more prepared, I would argue, in particular around water delivery, and I'll make that point as we go along. So ensuring that all households have access to reliable and safe basic services has been a challenge for decades. And this is again the point that we're trying to make in this chapter. What COVID did is lifted the lid and exposed those vulnerabilities. The COVID pandemic brought this into sharp focus, showing in particular communities who still did not have access to good, potable, clean water. In fact, the tankering was still required in those communities. Increased vulnerability for women and girls has already been mentioned in the education chapter, but the women largely caring for the sick remain the same during the pandemics. And in fact, they care for the sick environments that do not have access to good quality water. So the point we're trying to make in the chapter on the water section is not just only about the inaccessibility to water, but also the sanitation issues. If you're tankering in water to communities, how long do those tankers sit and lie there? What are the issues around disease and health which might emerge from those tankers lying there? Do they get topped up? How do women get access to those tankers? Is there hand washing? Is there sanitizing, etc.? So we looked quite a lot on that in terms of social distancing as well as people congregated around the tankers to get access to the actual water sources. Unfortunately, we argue in the chapter that the interventions were only short-term and did not create regular access to water. And I think this is something that needs to be thought of a lot more as we go forward in this chapter and in the work that might carry on in the next phase of this work. Likewise, in food and nutrition, it's a similar story. So coming into the pandemic, we were already working off the back foot, if you like, on food and nutrition. Food insecurity is high and persistent in South Africa, and a number of households are at risk because they can't only get access to food, but they're locked into a system where they cannot afford to actually purchase food. So it's not just about producing their own food. And as you can see from all these graphics, the food insecurity trends, whilst they might have been decreasing somewhat, are still quite profound. And in fact, as you can see there, the indicators coming into the pandemic, we were already at about 25 and 10%, varying in that range. But more importantly, around the vulnerability of the food group in this chapter is the issue that we make and the concern we raise around childhood and especially the issues of malnutrition in children under 5 years of age and the micronutrient intake and deficiencies that might be occurring. I do want to stress that many of these issues will be brought up again, I think, in the health chapter. And so just to draw your attention to the fact that we're giving an overarching vulnerability, trying to show the faces of the vulnerable as they come through in the report. But what came out more critically was not, as I said, just access to food and the nutrition issues, but actually how people are locked into a system that persists. And then if you're in lockdown, you can't actually get into the system to actually purchase food. So the pricing of staple foods, although it has remained stable at a national level, the cost of core foods have increased more than 15% in low-income areas since coming into the actual pandemic. And here you see some data from August 2020, where we show the cost of a food basket, what it meant over time, and then how that correlated to whether you got any assistance or purchase power to actually get access to that food. So in terms of a snapshot of the basic, if you like, vulnerabilities coming out of the food work that we've done, again, we want to emphasize that the underlying roots of the system that drive the vulnerabilities are clear in the food system. The food system in which various food value chains are embedded is not working, at least from the work that has been shown in this chapter. Food access is a daily struggle for over 14 million South Africans, with malnutrition in its various forms a significant health challenge. What the COVID pandemic did is to shed a spotlight onto that and open up that whole area of concern. And then, as the NITS-CRAM survey shows, child hunger has now increased across the country, returning to the highest levels during the hard lockdown in May 2020. So in terms of a summary, food insecurity was already prevalent before the lockdown, as indicated by data on stunting and hunger, and the persistent challenges are influenced by economic status and price volatility. But the vulnerable groups, including children, would have been at high risk of food insecurity, both before lockdown, as we show in the data running into the pandemic, and then throughout the pandemic. So food insecurity, we argue in the chapter, is yet another example, and this is the point we're trying to drive home, of a chronic, persistent vulnerability that is exposed and often heightened by such a pandemic. If we now turn to primary health care, which there is a separate chapter on in this whole COVID report, but we touch on some of the issues that we believe show some of the vulnerabilities, while there has been a fairly good track record of trying to ensure that populations and people have access to free healthcare within a 5-kilometer radius with a number of visits, 120 million visits in 2015, when we go into a COVID situation, a number of behavioral issues start to kick in. And it was raised already in the education chapter, where people are nervous and afraid of sending, for example, children to school. And what you see here is similar kinds of data showing that behavioral, if you like, set of challenges. So a number of healthcare workers have been mobilized, obviously putting themselves at high risk and the risk for infections. But 50% of childcare visits in KZN across 11 facilities showed a drop in actually attending these facilities. And 23% of women indicated they could not access any medications, condoms, or contraceptives. And 35% of babies in a study that was done requiring vaccinations did not visit the clinics in April or May in 2020. And then many mothers in particular being constrained to access resources. So the insidious, if you like, everyday vulnerabilities are not just those brought in by an acute pandemic such as COVID, is actually, again, we argue, unveiled during this pandemic. So the main reasons for not attending clinics, for example, as you see here, is, for example, waiting times, afraid of getting the COVID or coronavirus, particularly for those in their 3rd trimester, for pregnant mothers, and babies between 0 and 6 months, as you can see cascading through that data. So the importance of preventative healthcare, and obviously this extends, and we show this in the chapter, although we don't have slides on it here for time's sake, but also the elderly, working with people who are in old age facilities, what did that mean, et cetera, et cetera. So the actual vulnerability spectrum is not just on pregnant women and young children, although that's important, but goes right across the age spectrum, and you can find that in the chapter. So turning just for a moment, just for an example, to children and adolescents, the South African Constitution guarantees that every child should have the right to basic nutrition, which you've already spoken about, which has been problematic, shelter, basic healthcare, and social services. While this has been put into effect, as you can see, the stats are showing that many children are multidimensionally poor. And this raises this concern, and I think the need for us to develop more of a syndemics approach, where you're bringing in these multi-dimensions into vulnerability and not just one singular driver. But that, we argue, as we conclude, as you'll see later on, we need much, much more data. The data that we've got to make those kind of multiple vulnerability intersections are not good enough, I think, to make firm and robust, if you like, interventions. Another significant finding of the study was that the rate of poverty was much higher among children in rural areas when compared to those in urban areas. And it is therefore plausible to expect that the lockdowns and the result of COVID may have worsened the levels of poverty and inequality. But again, making hard statements on this, I think, is constrained by the fact of the hard data. So children and foster care, it is reasonable to conclude that the South African government was able and worked very hard at providing a safety net, but we argue much more can be done, particularly in tracking, monitoring, and evaluation. Finally, in the chapter, we try and deal with a group of people and parts of the population who are often sometimes fall off, if you like, the vulnerability and various designs and interventions. And these are refugees and migrants. They are usually already, again, the point being made, they're already beset by a number of vulnerability drivers that are weakening their ability to bounce back in any kind of a disaster, whether that be a drought, flood, or in this case, a pandemic. So very weakened social support structures, bleak socioeconomic prospects, unequal access to healthcare, etc. And a number of factors that we read about, for example, in the press, and some are trying to get the evidence on, things like scapegoating for foreign nationals, the issue of xenophobia, lengthy impermanent status to get access into the country, and then the various bureaucracies that can, if you like, tie people down and prevent them from getting access to good sources for well-being. And so in the chapter, we unpack that by showing that during lockdown and the various risk-adjusted periods, the crisis faced by foreign migrants was really a triple whammy, where you had a protection crisis, beginning with curtailed access to asylum, detention, all those sets of issues that already placed people in a vulnerable situation, compounded by a health crisis with unsanitary issues, the issues of food insecurity, which we've already touched on, and then the socioeconomic crisis, where this group of people really struggling to get formal recognition and rising unemployment and the loss of livelihoods. So being excluded from food aid, various social relief structures and business relief funds makes this group, in fact, particularly vulnerable. And the extension we suggest of some issues that might have benefited the group, some regulations, some civil society and human rights groups that may have lifted this group temporarily, at least, out of vulnerability. So in the chapter, what you've seen, and there's much, much more detail on, for example, water tankering, how did that go, et cetera, but we'll leave that for you to all have a look at and read. But there are a number of fun findings that we want to conclude on and also tie these back to the Disaster Management Act 57 of 2002. And in the Disaster Management Act, there is extensive detail on how we should be monitoring and evaluating all these issues. And so I think a lot of research now needs to be done on how we coped and the vulnerabilities and the details of those, but more importantly on the concatenation or the coming together of these vulnerabilities, because I don't think that has been well done yet. So in terms of some preliminary findings, we would argue, and we do in the chapter, that vulnerability has always existed, not least in the nutrition sectors, in the water sectors, in the housing sectors, according to different generations, depending on age groups, etc. And this, what has happened is that COVID has just exposed those insidious vulnerabilities and brought them to the fore. It seems trite to say that everyone has been impacted by COVID, but I think that's true. All of us have been affected by COVID. But the particular impacts, as was mentioned by Tim and others, and is shown in this chapter, and obviously we don't go into detail on gendered issues, etc., because that's another chapter that's coming shortly after us. So again, we draw on some of those issues, but we try and give this overarching narrative, particularly calling for much, much urgent action on insidious vulnerabilities. So women, children, the elderly, and the disabled, as well as refugees and migrants, particularly impacted, as we've shown. The lack of access to water and sanitation and food security, I think really, in my view, and this is a personal opinion, come up as glaring issues, which it seems tragic that we haven't made more inroads on, in particular on water. We've known about the water situations because they raised their heads, particularly in drought times, and the fact that we were still tankering in water many, many years after the change in governance in the country, and for the calls in those early days on drought relief, etc., I think really require much, much more proactive work going forward. Access to healthcare has always been uneven, but there have been interventions, and those you'll see also in the health chapter that is written in this general tome on the COVID. It's put, however, increased vulnerabilities on already overburdened health facilities, and you see that in the popular press, coupled with issues of various governance challenges. And finally, I think this is the call that the education chapter was also making, and we make it also very strongly in our chapter, that we need much, much more nuanced data across a range of scales. And if you look at the Disaster Management Act, and I'm now reading from the Act, bullet number 17, there is an entire set of bullet points around early warning systems, around schools, around police stations, around hospitals, around churches, around schools, around firefighting services, around various responses, all detailed in the Act, and I think requiring much, much more attention to detail as we go forward. So I just want to thank everyone that helped us write this chapter. It was a big ask and very difficult to capture in minutiae, I think, all the intersectionalities that are going on in the vulnerability arena. And I'd also like to thank those who are going to give us some valuable inputs going forward. Thank you very much.